Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm joined by Andrew Headrick, the founder and CEO at Kavira Health. Andrew, how are you today?
Doing well. Thanks for having me on, Jared.
Yeah, excited to chat. Would love if we could kind of just dive right into it. We keep these short and sweet, so would love to hear about your background and then we can talk more about the company.
Yeah, definitely. I grew up in Minneapolis, Minnesota. I have a decent background in the healthcare finance space. So I was in healthcare investment banking, where I completed 13 transactions worth over $4.3 billion, all focused on healthcare companies. And 2 years ago, I started Kavira Health, which is a subscription based primary and urgent care clinic that delivers all care via telehealth and in person home visits. That subscription is typically paid for by an employer, and the employees in turn receive unlimited, on demand, completely free access to our decentralized clinic, again through that telehealth, so through an app on their phone, and via in-person home visit. So we'll actually send a clinician to their home and deliver care in the living room. And our mission is to provide the most convenient and the most affordable everyday care possible.
Really cool. Um, so that kind of ties into my next question, really around. I know you hit upon a few of these, but I'm going to ask you to elaborate a little bit on top of them. Every guest we have on, I ask them the why, how, what of the company. So tie this in. I'm assuming there's a personal why that's attached to why you started the company, but would love to hear more about that.
Yeah, definitely. There's really, like you mentioned, there's those really two reasons I started the company. The first is personal, which is I grew up in a large family. I have quadruplet younger siblings, which is four kids that were born all at the exact same time. So as you can imagine, things were incredibly hectic in the best way possible in our home growing up. And so on basically a monthly basis, one of the five of us would get sick and my mom would have to drag all of us to the clinic. And so I have a lot of experience, a lot of personal experience in the healthcare system. And from a really young age, I kind of realized that healthcare can be inconvenient and expensive. Now, fast forward 25, 30 years, and I'm dealing with this on my own. And I've realized that, so I guess, why is this important? Primary care is really important. It's the only discipline in medicine where more care results in better health outcomes, longer life expectancy, all at a lower cost. And so it's really important that we get the primary care, get those annual checkups. The issue is that primary care visits have been decreasing over the last 2 decades. And if you look at the reasons why, people are basically saying it's too inconvenient and it's too expensive. And the data bears that out, right? So the average American is spending over $600 out of pocket every single year to cover their everyday healthcare expenses. Um, on top of that, 43% of Americans can't afford their deductible. And that means they're functionally uninsured, and it makes it really hard to just cover those everyday healthcare needs that a lot of us have. And so I started to experience that once I was taking care of myself. And I think we all, that's kind of the analytical side. I think we all understand this intuitively, right? If you want to set up a primary care visit, you have to figure out who's in network, who's nearby, who's accepting new patients. You have to drive across town, sit in a stuffy, germ-filled waiting room, where you sit there waiting for an appointment that is bound to start late. It's just kind of an inconvenient appointment. On top of that, you have to pay for it with copays. There's insurance hassles and there's surprise bills, and all of that is enough to keep all of us out of the primary care clinic, which is it comes at the detriment of us individually, but also the system as a whole.
And can you talk us through a little bit around? I know you've mentioned parts of this, but why primary care is important?
Yeah, like I mentioned a second ago, so primary care is the only discipline in medicine where actually more care. So the more care you receive, the the lower your costs will be down the road. So there's a study out there that demonstrated that every dollar invested in primary care actually results in $13 of downstream healthcare cost savings, which is really quite incredible. And the way that our system is set up today is that if you I like to use the analogy of a gym. So let's imagine we know that going to the gym is really important. We know that we should all be going to the gym more often, myself included. But what if I charged you $25 every time you went to the gym, or $50 every time you went to the gym. My guess is that you'd stop going to the gym quite as often and you'd become ultimately less healthy. And that's exactly what we're doing in the primary care setting. Primary care is really important, but we're charging people quite a bit just to talk to their doctor. And what that has resulted in is we've lost touch with that provider patient relationship, and so people often don't know where to turn when the little things come up, and what that means is down the road those little things can and do become big things.
So let's switch focus here a little bit, Andrew. Thank you for sharing that, by the way. Let's say I'm a patient. Give me an example of how I would use Kavira Health.
Yeah, so if you remember, you would reach out to us first through the app. You could also call or text us if it's easier through the app. There is no copay, there's no insurance hassle, there is no surprise bill. It's completely free to reach out to us, and through the app we can do a lot. I think we've all discovered how powerful telehealth can be. We can diagnose, we can prescribe, and we can refer out to specialists. However, about 30% of care still that in-person piece is still necessary. So this is the really unique part about Kavira. If you reach out to us and we need to go see you in person, we're actually going to send that clinician to your home and take care of you in the living room. So I'll give you an example. Let's imagine that you wake up with a sore throat and a fever. We'd say, yeah, it sounds like, Jared, you probably have strep throat, but let us come and take a closer look at it. We are then that morning going to send a clinician to your home. We're going to administer a rapid strep test in the living room. If you do indeed have strep, we're going to provide you with medication right there on the spot that our nurse practitioners bring with them to every house visit. Now, you compare this to essentially any alternative, you're going to be saving probably hundreds of dollars. You're also going to be saving probably a couple hours of your time. My favorite part about this is you're sick. You really should be at home drinking liquids and resting, and this allows you to do just that.
And when I hear this, I'm going to ask this, and I'm not saying it to be critical, just for I want to dive more into it. So, it sounds like it could be less efficient on your end to have to go through like this whole process, right? Of when you're helping. So, how are you able to save costs?
Yeah, so there are actually a few ways that we're able to reduce our spend. One is that we don't have a physical brick and mortar location. All care is delivered remote, which means because we've gotten rid of that physical brick and mortar location, we're able to significantly reduce our operating expenses, and we pass those cost savings on to individuals. Additionally, because this is fully paid for on a subscription basis, again, there's no copay, no insurance hassle, no surprise bill associated with reaching out to us. There's no cost after that subscription has been paid. Um, we're not dealing with, we're not dealing with insurance. We're not dealing with some of the middlemen there, which means we're able to actually reduce our costs by being paid directly. We're able to reduce our costs as well. So yes, it's kind of ironic that by going into people's homes and seeing people in a more efficient manner, we're actually able to reduce costs on our end.
And what's next for you in Kavira Health?
Yeah, the right now we're located in the greater Twin Cities metro. This is up in Minnesota. And the plan is to continue to expand this and hopefully expand across the country.
Super exciting. Well, we look forward to having you on, hopefully again, to give us an update on where things are at and follow your journey. Thank you so much, Andrew, for joining us on the podcast. Really appreciate it.
Thanks, Jared.